Guys, so today I want to talk about letters of recommendations. This was probably one of the hardest parts for me during my application cycle because you gotta think about all the people that are willing to sit down and write the best letter they can for you to get accepted into pharmacy school. So today I'm gonna give you guys 6 tips. Let's get started. Tip number 1, who should I ask? Most schools will require 2 letters of recommendations. That's most schools. Some schools can require 3, but most schools require 2. I would advise to get 3 letters even if the schools you're applying to are only 2. 4 if you can, because this is just to be sure, like just in case someone ends up not coming through, or just as a backup also. And the more letters the better. Some schools don't even accept more than 2 letters, so you can't submit that many, but it's better to have more. So I would say 3 is a lucky number. 3 is ideal and 4 is even better, but I believe 3 is the best. That's what I got. So my suggestion is to have at least 1 professor, 1 healthcare provider like a pharmacist, for example. The 3rd is your boss or supervisor when you're volunteering. All these people can give judgment on how you work in a professional kind of environment and level. Tip number 2 is, how do you ask them? So this is kind of a tough one, right? One of my letters was from a professor that I haven't seen in a couple years. I kept in contact with. I no longer went to that school, so I contacted him through email. Of course, I would highly advise to ask in person, but when you don't know someone's schedule and it's kind of hard to meet up like that, I believe an email is okay. If you haven't talked to the professor in a while, you can always email them. Just say, hi, like you probably remember me in your class when I used to, I don't know, like interrupt your lectures or ask you questions after class every day. Say something good about you that they'd probably remember and click in their head of who you are. You can say something along the lines of, I'm applying to pharmacy school this cycle. It would be an honor if you could write me a letter of recommendation. I'm just gonna move along to tip 4. Hey guys, I totally skipped over tip 3, which is when you should ask for a letter of recommendation. I would advise to ask 1 to 2 months in advance and give them a due date of 1 week before you're actually going to submit your application. I'm just gonna move along to tip 4, which is actually to offer your personal statement. Offering a personal statement will help everyone and give your professor an idea of why you want to choose this profession. You can even say that you're willing to meet up, have a conversation if they have any more questions or want to get to know you on a deeper level. I contacted a handful of my old professors. I needed that last letter of recommendation. Some professors won't respond, like that's just how it is. They're busy, probably don't remember who you are, maybe they don't want to write you a letter of recommendation. I closed off every message saying that don't feel obligated if you can't write me a strong letter of recommendation. And for tip 5, I want to give you a rundown of the type of questions they ask in PharmCast. For PharmCast, they ask for a letter of recommendation, but they also ask a series of questions to see how well your interviewer knows you. I'm gonna look over here because I'm reading off my phone. This is directly on the PharmCast website, and I remember one of the persons that were writing my letters actually showed me, and it was similar questions. It says, how long have you known the applicant? It has the choices of less than 1 year, 1 to 2 years, 2 to 3 years, so on and so forth. And then it says, how well do you know the applicant? Very well, moderately, minimally, or not at all. In what capacity do you know the applicant? And it says employee, supervisor, colleague, coworker, advisor, internship. And then there's an evaluation rating, which the person has to rate you as either excellent, good, average, below average, poor, or not observed. The ratings are of oral communication, written communication, intellectual ability, leadership, ethics, empathy, reliability, judgment, interpersonal relations, adaptability, and professional appearance. One of the last questions is the overall recommendation, and the choices are, I highly recommend this applicant, I recommend this applicant, I recommend this applicant with some reservations, and I am not able to recommend this applicant. So be sure that the person that's writing your letter of recommendation could answer these type of questions because you don't want the ratings to be low. So my last tip, tip 6, is to write a thank you note after you're done. You can grab a bunch of thank you cards at like Ross or TJ Maxx. They sell really nice ones in a bundle of like 12 for like $4, and as a broke college student, I think everyone would want to know about that. Yeah, it just says thank you on the outside, and the inside is a blank card. It's a little tiny card, about the size of like an index card, maybe a little bit bigger, and you can just write a note quickly about how you appreciate it, you know, just to give thanks for taking the time out of their day to write a letter for you. But yeah guys, the letter of recommendation almost held me back on applying the last cycle. I was worried I wasn't gonna have the appropriate letters of recommendations, the amount, or as from a pharmacist, but I figured it out, and you just have to ask as many people as possible. And if you're not applying this cycle, this video should give you an idea of to reach out to your professors, go to their office hours, volunteer, talk to your supervisors, get a pharmacy technician job, be close to the pharmacist you're working with so that they can write you the best letter of recommendation they can. All right guys, so until next time, bye.